I want you to think about a moment that most people over 60 have experienced, but almost nobody talks about openly. You are walking through a parking lot, or maybe you are coming down a flight of stairs, and for just a split second, your body hesitates. Your leg feels uncertain. Your balance wavers slightly, and in that fraction of a second, a quiet fear passes through you that you have never quite felt before. Not a dramatic fear, just a whisper that says, "Am I starting to lose control of my own body?" If you have felt that whisper, I need you to understand something right now before we go any further. That feeling is not the beginning of the end. It is a signal. And signals, when you know how to read them and respond to them, are actually gifts. Because what your body is telling you in that moment is not that decline is inevitable. It is that your strength, your balance, and your mobility need specific targeted attention right now. And the research is extraordinarily clear on what that attention should look like. There are 5 exercises, 5 specific movements that take under 20 minutes daily that have been shown in peer-reviewed clinical studies to rebuild the exact physical qualities that begin slipping after 60. Strength, balance, mobility, coordination. The things that determine whether you age on your own terms or on somebody else's. Stay right here because this video could genuinely be the turning point you did not know you were looking for. Welcome, and if this is your first time on this channel, I am so glad you found us. This is Dr. Alex Morgan, Aging Wellness Lab, and everything we do here is built around one mission, giving people over 50 the real research-backed information they need to take control of how they age. Not scare tactics, not miracle cures, just honest science translated into honest guidance that works in real daily life. If that sounds like what you have been searching for, please hit subscribe right now and give this video a like. It genuinely helps this information reach more people who need it, and what I am covering today is exactly the kind of content that this community was built to share. All right, let us get into the full picture, starting with the biology, because that is what makes these 5 exercises so specifically powerful. After 60, 3 things happen to your body simultaneously that together create the physical changes most people associate with aging. The first is sarcopenia, the progressive loss of skeletal muscle mass that begins in your 30s but accelerates dramatically in your 60s and beyond. Research shows that without active intervention, adults lose between 3 and 8% of their muscle mass per decade, and that rate nearly doubles after 60. The muscles most affected are the large, powerful muscles of the lower body, so the quadriceps, hamstrings, and glutes, because these muscles are among the most metabolically demanding in the body and the most sensitive to the hormonal changes that accompany aging. When these muscles weaken, everything built on top of them becomes less stable. Posture suffers, gait changes, the risk of falling increases, and the capacity for independent, confident daily living begins to quietly erode. The second thing that happens is a decline in proprioception, your body's internal sense of where it is in space. Proprioception is generated by specialized receptors in your muscles, joints, tendons, and skin that continuously send positional information to your brain. Your brain uses this information to make thousands of tiny automatic adjustments to your posture and movement every second of every day. You never think about this process. It just happens until it starts to slow down. After 60, proprioceptive sensitivity decreases measurably. The receptors become less precise, the signals travel more slowly, and the brain's processing of those signals becomes less efficient. The result is the subtle unsteadiness, the slower reaction to unexpected shifts in terrain, and the growing hesitancy in movement that many seniors experience, and most attribute simply to getting old. It is not just age, it is a specific, trainable sensory system that has been underused and understimulated, and it responds to targeted exercise in a way that most people never discover because nobody tells them. The third thing is a reduction in joint mobility, specifically the range of motion available at the hips, knees, ankles, and thoracic spine. Joints are kept mobile by the synovial fluid that lubricates them and by the muscles, tendons, and fascia that cross them. When physical activity decreases, as it naturally tends to after retirement, after children leave home, after the social structures that used to demand regular movement dissolve, the joints move through smaller ranges of motion, the synovial fluid circulates less efficiently, the surrounding soft tissue shortens and stiffens, and the available range of motion gradually contracts. This is why older adults often describe feeling stiff, tight, and locked up, particularly in the morning or after sitting for extended periods. And reduced joint mobility is not just uncomfortable, it changes the mechanics of every movement you make, creating compensations that overload certain tissues and underuse others, accelerating wear and increasing injury risk. Now here is the critical insight that shapes everything we are going to do today. And this is something that I always come back to at Dr. Alex Morgan, the Aging Wellness Lab, when we talk about exercise for seniors. The goal is not to get fit in the way a 30-year-old athlete is fit. The goal is to be specifically functionally capable, to have exactly the strength, balance, and mobility that real daily life demands of a person in their 60s, 70s, and beyond. Getting up off the floor without help, walking on uneven ground without fear, reaching overhead without pain, carrying groceries with stability, climbing stairs with confidence. These are the performance standards that matter, and the 5 exercises I'm about to share are designed with exactly those functional standards in mind. The first exercise is the chair-assisted single-leg deadlift. And before you tune out at the word deadlift, stay with me, because this version is nothing like the gym exercise you might be picturing. Here's how it works. Stand behind a sturdy chair and place both hands on the back for support. Your feet are hip-width apart. Shift your weight onto your right foot and slightly lift your left foot so just your toes are touching the floor. A toe tap rather than a full lift. Keeping your back straight and your core gently engaged, hinge forward at your hip, just a slight forward lean of your upper body, while simultaneously extending your left leg behind you, lifting it just a few inches off the floor. Hold for 2 seconds, then return to the upright starting position. Do 8 to 10 repetitions per side. What this movement does is train 3 things at the same time. First, it strengthens the hip extensors, the glutes and hamstrings, in a hinge pattern that directly mirrors the mechanics of picking something up off the floor, stepping over an obstacle, or recovering balance when your weight shifts unexpectedly forward. Second, it challenges single-leg balance in a controlled, supported environment, building the proprioceptive sensitivity and stabilizing strength that reduce fall risk. Third, it trains hip hinge mechanics, the ability to move at the hip rather than rounding the lower back, which is one of the most important movement skills for protecting the lumbar spine during daily activities. This one exercise, practiced consistently, rebuilds functional strength and balance in a movement pattern that your daily life demands of you every single day, whether you realize it or not. The second exercise is the wall-supported thoracic rotation, and this one addresses something that almost never gets discussed in mainstream senior fitness content: the mobility of the thoracic spine, which is the middle segment of your spine running from roughly the base of your neck to the bottom of your rib cage. This region is designed to rotate. It has more rotational capacity than the neck or the lower back, and it serves as the primary rotation engine for the entire upper body. When it gets stiff, which it does when we spend years sitting in flexed, forward-rounded postures, the rotation that daily life demands does not stop being demanded. It just gets taken from somewhere else. Usually the lumbar spine, which is not designed for rotation and which develops pain and injury when forced to provide it repeatedly. Restoring thoracic rotation is one of the single most effective things an older adult can do for lower back pain, shoulder pain, and neck pain simultaneously, because it gives rotation back to the structure that was always supposed to provide it. Here is the exercise. Stand sideways next to a wall, close enough to place your near hand flat on the wall at shoulder height. Your feet are hip-width apart, knees slightly bent. Place your other hand on your opposite shoulder. Now slowly rotate your upper body away from the wall, leading with your elbow, following the rotation with your eyes and your head. Rotate as far as you comfortably can, then slowly return. Do 10 repetitions, then turn around and repeat on the other side. Over days and weeks of consistent practice, the available range of rotation will increase noticeably, and as it does, the compensatory stress on your lower back, your neck, and your shoulders will decrease, often producing pain relief in those areas that people had assumed was just something they had to live with. The third exercise is the step up with knee drive, and this one is my personal favorite on this list because it trains the most functionally critical lower body strength pattern in a way that directly transfers to real life, and that is stair climbing. The ability to climb stairs confidently is one of the most significant markers of functional independence in older adults. When stair climbing becomes difficult or feared, it starts to restrict where people go, what they do, and ultimately how they live. The step up with knee drive rebuilds the exact strength pattern that stair climbing requires, while adding a balance challenge that makes it more effective than actual stair climbing as a training exercise. Here's how you do it. You need a single step, a stair, a sturdy step stool, or an aerobic step platform if you have one. The height should be comfortable, somewhere between 6 and 8 inches to start. Stand in front of the step, place your right foot flat on the step, and drive through that right heel to step up. As you reach the top and your body is fully upright, drive your left knee upward toward your chest, a deliberate, controlled knee drive, so you are briefly balancing on your right leg at the top of the step. Hold that single leg position for 2 seconds, then slowly lower your left foot back to the ground. Do 8 to 10 repetitions per side, using a wall or railing for safety support if needed. The knee drive at the top is what elevates this exercise beyond a simple step up. That moment of single leg balance at the top, combined with the hip flexor activation of the knee drive, trains the neuromuscular coordination of stepping, the precise pattern of weight shift, hip stabilization, and balance recovery that occurs with every step up a staircase. It also trains hip abductor strength on the standing leg, which, as we discussed earlier, is critical for knee alignment and fall prevention. This one exercise essentially packages stair strength, balance training, and hip stabilization into a single movement. When you get strong enough to do 15 repetitions per side without holding a support, your stair climbing confidence will reflect it immediately. The fourth exercise is the seated ankle alphabet, and this is one that surprises people because it looks almost too gentle to be meaningful, until you understand what the ankle actually does and why its mobility and strength are so critical to everything above it. Your ankle is the foundation of your entire kinetic chain. Every bit of force that travels from the ground up through your legs, hips, and spine starts at the ankle. When ankle mobility is restricted, which it commonly becomes in older adults due to reduced activity, tight calves, and the general shortening of the Achilles tendon and plantar fascia, the movement restrictions ripple upward. The knee compensates, the hip compensates, the lower back compensates. Poor ankle mobility is a root cause of knee pain, hip pain, and lower back pain that almost never gets identified because nobody is looking at the ankle when the patient is complaining about their knee or their back. The seated ankle alphabet is a simple but comprehensive ankle mobility exercise. Sit in a chair with your feet flat on the floor. Lift your right foot just off the floor and use your foot and ankle, not your whole leg, to trace the letters of the alphabet in the air. Go through all 26 letters, moving slowly and deliberately, making each letter as large and clearly shaped as you can. This forces your ankle through its full range of motion in every direction: plantar flexion, dorsiflexion, inversion, eversion, and every combination thereof. Then switch feet. Do this daily, and within 2 to 3 weeks, you will notice measurable improvement in ankle mobility, a reduction in morning ankle stiffness, and improvements in the overall smoothness and stability of your gait. The ankle alphabet also gently strengthens the smaller stabilizing muscles of the ankle and lower leg that are often weak in older adults who have spent years in supportive, restrictive footwear. And strengthening these muscles directly reduces ankle sprain risk and fall risk. The fifth exercise is the standing hip circle, and this one targets hip mobility in a way that addresses one of the most common and most limiting movement restrictions in adults over 60, reduced range of motion in hip rotation. The hip is a ball and socket joint designed to move in 3 dimensions: forward, backward, sideways, and in rotation. But most of our daily activities, like walking in a straight line, sitting, standing, uses only a fraction of that available range. The rotational capacity of the hip, in particular, tends to atrophy dramatically with age and inactivity. And reduced hip rotation has consequences that extend far beyond the hip itself. It reduces stride length, changing gait mechanics in ways that increase energy expenditure during walking and reduce stability. It increases the rotational demand on the lumbar spine, the same problem we discussed with thoracic stiffness. Because when the hip cannot rotate, the lower back gets recruited to provide the rotation instead. And it contributes to the gradual forward-hunched posture that many people associate with old age, because restricted hip extension forces the pelvis into a posterior tilt and the spine into compensatory flexion. Here is the exercise. Stand next to a wall or chair for support. Lift your right knee to hip height, or as close as you comfortably can, and slowly draw a large circle with your knee in the air. Forward, out to the side, back and down, then reverse the direction. 10 circles forward, 10 circles backward, each one as large and smooth as you can make it. Then switch legs. The motion you are creating at the hip joint, the combination of flexion, abduction, external rotation, extension, and internal rotation that makes up the circle, is the full available range of the joint. Practicing this range daily keeps the joint lubricated, maintains the flexibility of the surrounding capsule and musculature, and preserves the hip's 3-dimensional mobility in a way that straight-line exercises like squats and lunges never fully address. What I love about the hip circle as a daily practice is how immediately most people feel its effect. And after a week of consistent practice, the motion starts to feel smoother. After 2 weeks, the range starts to increase. After a month, people notice that getting up from the floor is easier, that their stride feels freer, that the stiffness they used to feel in their hips after sitting for a long time is less severe and resolves more quickly. These are real felt changes that motivate continued practice. And continued practice is everything when it comes to maintaining physical capacity as we age. Now let me give you the practical framework for putting all 5 together in a daily routine that is realistic and sustainable. The entire sequence: chair-assisted single-leg deadlift, wall-supported thoracic rotation, step-up with knee drive, seated ankle alphabet, and standing hip circle, can be completed in 18 to 20 minutes when done consecutively. You do not need to do them all at the same time if that is not practical. The single leg deadlift and step up can be done in the morning as a strength session. The thoracic rotation and hip circle can be done in the evening as a mobility session. The ankle alphabet can be done while you are watching television or having your morning coffee. It requires no dedicated space and no standing at all. Breaking it up this way makes the daily commitment feel smaller, reduces the mental barrier to starting, and actually mirrors the way many physical therapists structure programming for older adults. Movement snacks throughout the day rather than one concentrated block. Consistency matters more than intensity here. A light, consistent daily practice produces better outcomes for strength, balance, and mobility in older adults than occasional intense sessions with long gaps in between. The neuromuscular adaptations, the proprioceptive improvements, the joint mobility gains, all of these develop through repetitive, frequent stimulus over time. Think of each day's practice not as a workout, but as maintenance, the same way you would not skip brushing your teeth for a week and then brush for an hour to make up for it. Daily, consistent, gentle but deliberate movement is the habit that changes the aging trajectory. I want to say something directly before we wrap up today, and it is something that I feel genuinely strongly about after years of studying the intersection of aging and physical function at Dr. Alex Morgan, Aging Wellness Lab. The narrative around aging in this country is deeply and harmfully passive. People are told to slow down. They are told to be careful. They are told that aches, stiffness, weakness, and balance problems are normal and expected. And while it is true that aging changes the body in real ways, the conclusion that those changes are inevitable and irreversible in most cases is simply not supported by the science. The science says that muscle responds to training at 70. That balance improves with practice at 75. That joint mobility increases with consistent movement at 80. That the body, at virtually any age in the absence of severe disease, retains the capacity to adapt and improve when given the right stimulus. You are not past the point where effort matters. You are not too old to get stronger, more balanced, and more mobile than you are right now. But you have to give your body the stimulus it needs to adapt. And you have to give it that stimulus consistently, not once and not occasionally, but every single day as a non-negotiable part of how you live. These 5 exercises are not a program, they are a practice. And like any practice, they give back in proportion to the consistency with which you show up for them. Before I let you go, I want to ask you something specific. Drop a comment right now and tell me, out of these 5 exercises, which one do you think you need the most? Is it the single leg strength work because your legs have been feeling unreliable? Is it the balance training because you have had a close call recently that shook your confidence? Is it the hip mobility work because your hips have been feeling locked up and stiff? Your answer helps me understand this community better and helps me create the content that serves you most. And more importantly, writing your answer down makes you more likely to act on it today. Not next week, not when you feel ready, but today. Because today is when it matters. And please, share this video with someone who needs it. Share it with a parent, a spouse, a friend, or a neighbor who has been quietly struggling with weakness or balance concerns and does not know where to start. This information could be the thing that changes the direction they are heading. That is the whole reason this channel exists. And sharing is the most powerful way to support that mission. Subscribe if you have not already, show up for your daily practice, and I will see you in the next video at Dr. Alex Morgan, Chia Aging Wellness Lab, where we will keep going deeper into everything your body needs to stay strong, balanced, and fully capable in every year ahead.